good to see you. It's a smaller atrium than we remember. Whoa, and there's way more cameras than we've seen. Surprise! Yeah, no kidding. So let me just check who's handling staging. Is it Justine or Jesse? Okay, well, good morning, everybody. And we're going to get started here. We have a couple of things. We're obviously going to talk about our community safety department that we'd like to create here in the city of Albuquerque. And so we do have a number of folks who need to speak on this. So I'm just going to let folks know this briefing is going to go for a little longer than sort of they normally do. We'll, of course, save time for questions at the end. We also have some community folks here. I know we're trying to do the best we can with respect to communicating with the public and community leaders, but also social distancing and the public health situation. So we are going to actually kind of go one by one with folks who are going to come up and speak. So just letting folks know, again, we're going to have kind of one speaker at a time, and then we'll do questions at the end and pull up whoever we need. And again, just because of space kind of concerns there, everyone is just standing behind the screen. So you'll see folks kind of come on stage around the screen. So we are going to hear from our CAO. We're going to hear from our Director of Equity and Inclusion. We're going to hear from the head of our diversion program. We're also going to hear from our commander right here in the Southeast Heights. And we're going to hear from our city councilor, who's the chairwoman of the Public Safety Committee. So before I begin, let me again thank everyone for coming. And I also just want to mention that we are just exclusively going to focus on our concept for advancing this notion of community safety in Albuquerque. So if there are questions on other topics, we can try and take them after, but we're asking folks to kind of prioritize questions on this specific topic. So we're here today to make an announcement that we believe is going to make a major meaningful shift in the way we approach public safety in Albuquerque. And for us, over the past 2 years since taking office, public safety has been a top priority. And we've always said that public safety needs to be addressed on all sides. And this concept really honors that commitment. So for us, this means that everyone in Albuquerque should be able to feel safe and live free from violence. And an emphasis again on everybody. That includes folks from all walks of life and all ethnicities. For us, this also means that we have to tackle violent crime. We know that we have a major violent crime problem in our city, but it means we also have to understand the drivers of that violent crime. And that means addressing issues like race and equity. It means mental health, addiction, poverty, and homelessness. It also means interrupting the cycles of violence. We know that one of the challenges with violent crime all around the country and here in Albuquerque is that it's often retribution-based. And so breaking those cycles is extremely important and is at the heart of our violence intervention initiative, which we're going to speak a little bit about today. It also means addressing gun violence. You know, we know that situations, especially around domestic violence, even around child abuse, when there is a weapon in the household, that's when they become deadly. And so that's also part of what we're going to talk about today. So all of these factors require specialized actions. But I think as a country, we have come together for decades and lumped them all together. And in many ways, this has criminalized the responses to these issues. Now, what this means is that we've placed more and more issues on the plates of officers who are not trained, despite their best efforts and despite some training. They're not totally trained to be a social worker or to be an addiction counselor or to deal with things around child abuse when they're just answering a call. So for us, this has strained an approach that I think has long been building, again, all around the country. And it's a challenge on both sides of the equation. It's a challenge for our officers, but of course it means that response for the community is often less effective. And so in many ways, our city has actually been a little bit ahead of other cities because we have acknowledged these challenges and we've been trying to face these. And again, that's in the context of addressing crime from all sides. It's also in the context of the DOJ reforms. So we know in every way, we have a long, long way to go on all of these issues. But Albuquerque has to carve its own path. And our own path means understanding both where our community is at and also where our city government is at and where our police department is at. And in some ways, we are just a little bit ahead than a lot of other cities around the country. And with this announcement, actually, it puts us at the forefront in the nation on dealing with these issues. Now, we got down to work with respect to meaningful reform in this area by putting together efforts that combined what we're working on with the DOJ, but also our public safety working group, which in our city has been Family and Community Services. It's been fire department. It's also been folks in our homeless department along with police trying to understand these issues. So this idea is really born out of ideas that we've been piloting and testing for a couple of years. Now, through the reform process, our Homeless Advisory Council, our town halls, and our engagement with neighborhoods, and our many boards and commissions, which we've worked hard to try and make more reflective of our city's population, we have been engaged in real and tough conversations about public safety. And for us, that conversation has to continue in a way to help us make this department real. But our residents have shared their hopes and fears when it comes to making our city safer. And what has emerged, I think, is a very structurally meaningful answer to what our city is dealing with. So I also want to share that for me personally, where this started, I was on a ride-along when I was a candidate for mayor. This was before I was mayor. And these are actually really hard to do, even when you're a candidate running for office, because of a whole host of reasons. And I have a number of stories from that ride-along. It was a Sunday night, I believe, and it was, again, the sort of late shift for us. And for us, I just want to tell you about 2 calls. We took, I think, a total of 6 calls that night. But one call was for a youth that was in the emergency room. And this was a child, it was a person of color, and it was somebody who had been diagnosed with mental illness. But they were also becoming agitated and becoming moderately violent, meaning just sort of physically pushing back with doctors. So the ER doesn't know what to do. They call 911. 911 dispatches an officer and a mayoral candidate on a ride-along. And so this call, and I give all the credit in the world to the officer because he handled this amazingly. But here's what we had to do. We had to understand the medical situation from the doctors. We had to understand the physical situation with respect to medication they were trying to give him. Then we had to understand that this teenager was couch surfing, so technically sort of homeless. There was no adult we could call, no home we could take them to. And then we also had to understand that there were probably also some addiction issues also emerging, even though this individual was a teenager. And then we had to figure out what to do. So that officer had a choice. That officer could take them to jail. There was enough there probably to justify that. That officer could also take them or sit with them for 8 hours in the emergency room. None of those are the solutions that are right for that teenager. What this officer did amazingly was eventually patch them through to one of our New Day, in this case, who eventually, again, in the middle of the night, was able to take this individual and give them the kind of help that they needed to keep them out of the ER and out of jail. That call, by recollection, probably lasted over 2 hours. These are the kinds of calls that we really should have professionals taking, not armed officers. This officer did a tremendous job, but when you add up dozens of those calls all over the city every night, we understand that there is also a 911 system that is pulling officers away from violent crime and around crime calls, and it's taking them hours to deal with situations like the one I just described. Then I want to share, we looked at the ongoing call log. Our officers continue to just be completely behind the 8 ball when it comes to the number of waiting calls. We had dozens and dozens of calls, and we would sit there and he would kind of explain why he was picking different calls, but he couldn't pick even close to all of them. I mean, it took us almost 2 minutes just to scroll down the screen. So this is what's happening in our streets right now, and so I want to emphasize that this program has to fit Albuquerque, and that means we still have to get officers on the street. We still have to meet our shortage obligations that we've had for almost a decade now, a department that has been trying to work more with less. We've got to do something about that, and we're going to continue to do that. Now, the second call was a domestic violence call. And this was a situation where there obviously was a challenge in a sense that there was a weapon, we knew, and we had 2 squads of officers respond. That's roughly 8 officers. And again, in this case, it was diffused properly. But the question is, how could that have call been handled earlier in that situation to prevent that from happening? And also, what's the follow-up? Actually, because after this situation was sort of resolved from a tension aspect, was there help for those children right away? Was there services that could have been connected to? These are just 2 examples of what this new department can be helpful with. So we have many more, but I want to really touch on the fact that, for us going forward, we have to make sure that as we listen to the community, as we work with council to build out this department, and as we continue to work under DOJ reform, we've got to make sure that we are trying to do something meaningfully different than what we have been doing before. And we have learned by testing out these different areas that this is really the culmination of work for a concept that is the first of its kind in Albuquerque, and we believe actually nationwide. And fundamentally what it says is this: for 100 years, when you call 911 all across America, the response is fire or police or both. And we're adding a third response into that equation by developing a civilian, professionally trained approach, a public health approach really, to public safety. And that is embodied in our development of a department, the Community Safety Department. That's what we're announcing here today, that our administration is going to pursue the idea of creating this third department in our first responder system. Now, through this department, we're creating a new model for community safety that sends the right resource at the right time on the right call. And that's where our current 2 departments have always struggled. You have to send an overly trained person from one or the other to deal with situations we should really have others responding to. So this is about having a trained but unarmed professional responding to calls for mental health, for addiction, for inebriation, for homelessness, for down and outs, and even simple things like abandoned cars. We spend an inordinate amount of time sending officers out to check on abandoned cars. It also means simple things engaging the community like around traffic management, and how we can do that again with an unarmed professional. So inherent in this restructuring is also the question of what our city needs, and it's the rejection of a false choice between investing in community and in a capable police department. We know that in Albuquerque we have to respect the needed core police work that we need in our town, but we also have to include the fact that we've got to prioritize non-law enforcement alternatives when it comes to how we react in our 911 system and to challenges in our city. So in our city we must do both. We are not accepting a choice between one or the other. So with that, what I'd like to do is quite quickly hand it over to our CAO to talk a little bit more about this. But I do want to highlight, those of you who read the Albuquerque Journal, there was an op-ed in the Sunday version, and I rarely these days especially have time to go through every article, but this one was highlighted for me and it was especially good. And I want to thank Honor Joseph from HopeWorks Mobile Crisis Team. She's a clinician with that team, and folks can see this guest column that was online. But what I want to do is I just want to rephrase Honor's words and share them with you today. So she says, I listen to calls being dispatched every day that paint a rather bleak picture of our city. Many of the disturbances stem from the intersecting systematic issues. I wholeheartedly support implementing more non-law enforcement alternatives because frankly we put too much pressure on cops to fix everything. Now, there goes on to say that, let's see, sorry, the font is pretty small here, so I have to hold this close. It talks about abolishing APD is going, people say that abolishing APD is going to bring peace, but everything I've seen is we need police in the city. And in the same breath, we must also demand justice. It can be both. It's easier to hate, but only the way forward is what we need to do together. So again, that's paraphrasing a little bit from, I think, a very powerful op-ed from our community that folks can take a look at. So with that, let me hand it over to our CAO, Sarita Nair. Sarita?
Thank you, Mayor. Thanks, everyone, for being here. So over the last 2 years, the city has dramatically reformed its approach to public safety. Every week, we do something that very few other cities do. We get together key folks from all of the departments that touch public safety. Now, of course, that includes police and fire and emergency management, but it also includes the Office of Civil Rights, the Office of Equity and Inclusion, Code Enforcement, Transit, Municipal Development, Solid Waste, and Parks. And the group raises issues and challenges that we want to address using the best thinking of everybody in that room. We've worked on everything from traffic management at Balloon Fiesta to safer strategizing on some of the big COVID-related issues. And the diverse perspectives in that room all share the goal of making our city safer for everyone. And safety does not mean the same thing for all of our residents. For some people, seeing a police officer assures them and makes them feel safe. But for others, safety is about being able to get help from places and from people that have no connection to the criminal justice system. Everyone in that public safety working group room also shares a desire to be the most effective and efficient city that we can be. Sending 1 or 2 police units out to a call is one of the most expensive resources we can deploy. And because of the massive cuts to the APD budget during the last recession, our severely understaffed department was bending under the strain of too many calls. When we first started really looking at how we respond to calls from our residents, it was pretty shocking. We were sending police to reports of someone passed out on a park bench. We were sending police to reports of head lice that came in through the Children, Youth, and Families Department. We were sending police to every report of a homeless encampment. And by sending police to all of these calls, we were doing more than just overburdening these officers. We were sending the message that a wide range of social issues, including poverty, substance abuse, and behavioral health challenges, were in fact criminal problems. So we started asking the question of why. Why, for example, is that person passed out on the park bench? In other words, we started taking a public health approach to evaluating these calls and looking at what other kinds of resources we could send. And through a series of thoughtful experiments, we've seen that we can reduce the pressures on our officers and have better outcomes at the same time. We've moved over 15,000 down and out calls out of the police department over the past year. We've moved homeless encampment calls to our homeless outreach teams. We've started more organized deployment of the crisis outreach and support teams, the COAST teams that are currently operate out of APD. And in each instance, we found that we had a more lasting impact on the people we served. The new Albuquerque Community Safety Department will continue this work. This step is in keeping with the long, long road to reform and justice that we have been walking for the past few years. But here's the difference. Police reform is about improving how our officers do their jobs. Creating the Albuquerque Community Safety Department is about changing the what, the where, the when, and most importantly, the why of the role of the police play in our city. And we need both efforts to happen at the same time. In a planning process that will take place over the next several months, the city will gather input from experts and from the public on how to bring together this new department with both the existing resources we have currently spread around several departments and ultimately adding new resources to that group. We'll also work closely with the DOJ and the other folks involved in police reform on how we structure the new department and what types of calls they handle. One of the more complex challenges will be handling calls for mental and behavioral health challenges, which of course is why the DOJ came to Albuquerque in the first place. I just want to assure all of the people in our community who have devoted their entire careers to advocacy on these issues that we will involve them in planning a thoughtful and careful approach to this department. Just as the Fire Rescue Department currently does, if responders from the new department can always call for police for backup or assistance if there's a threat to their own safety or to the safety of others. We already know how to do that. We do that in our other response departments. And we already know that hiring social workers, who are going to be a key part of the workforce in this new department, is a challenge. We have trouble keeping the 4 social work contract positions at APD, of whom Honored Joseph is one, filled, because there's just a lack of professionals in that area. So we'll be working with our state's colleges and universities to create a pipeline program where we can help fund education for students who commit to coming to work for this new department after they complete their education. So with that, I will turn it over to Michelle Melendez. She's the director of our Office of Equity and Inclusion, and she's also has a long background as an anti-racism activist and trainer, and as a public health professional, and she'll be bringing all those areas of expertise to her role in working on this department. Thank you.
Thank you, Sarita and Mayor Keller. I've had the privilege over the past 20 years of being part of starting or helping sustain numerous community health initiatives and programs. And I'll mention a few of them here because all of them really help inform our thinking at this time. Since my days with the New Mexico Department of Health, where we really fought to have access to health care for all people. And that led to many, many different things, including a clinic in the South Valley that is doing remarkable work in behavioral and addiction treatment, unlike anywhere else in the country. That work at the Department of Health also helped lay the groundwork for a Pathways Community Health Worker program. Again, another remarkable example of what can be done through community action. We also, in my years at St. Joseph, helped start right here in this community the first free bilingual counseling program that the city had ever seen, and laid the groundwork for what later has become the International District Healthy Communities Collaborative. And now, from my vantage point as the inaugural director of the city's Office of Equity and Inclusion, we see very clearly that the pandemics of racism and COVID are very much exposing the extreme vulnerabilities of our city. And we recognize that this calls for all of us to join together to do something completely different. A social work response, an upstream public health response, and a safety net that is at scale with the needs in our community. And from dozens of meetings with Black Lives Matter organizers and the mayor and his staff over the past few weeks, we have listened, and the mayor has heard many, many people say that we need a better way. And I want to thank those advocates for their advocacy. It's time. And the establishment of this new department acknowledges the mismatch between the social needs of people experiencing nonviolent crises and the existing infrastructure that has attempted to respond to those needs. A social work response rooted in social justice gives us a much better chance of connecting people with the help that they need and getting better outcomes for people of color without involving law enforcement. This is key because people of color do not need more interactions with law enforcement. They know what they need, and they have told us many times. And it's time we listen, and we are listening. And just like the city cannot wait for the county or anyone else to step up to the plate, we in the community too cannot wait any longer to build our collective capacity to really meet the needs of our city together. And I thank the opportunity to help work on this.
Okay, so next we're going to hear from a woman who is also has a deep background in a lot of these related issues. Tania Covington came to the city maybe, was it 3 months ago? Corona time changed everything. So about 3 months ago, Tania started, and she has a career in restorative justice, and she's going to speak to a couple of things around our violence intervention program and our diversion program. And these are two examples of since we wanted to start these programs, we have been trying to understand, how do you institutionalize that kind of work? And how do we restructure the city to make sure that that work is real and meaningful for generations to come? And this department is part of that answer. And so to talk more about this, Tania Covington.
Hello, I'm glad to be here today. I just want to say that I joined APD to work on the Rapid Accountability and Diversion Initiative, which is part of the Violence Intervention Program, both of which are key in this new department. Restorative justice is basically what we're trying to do. Restorative justice centers on three concepts: repair, the crime causes harm, and justice should be about repairing that harm. The encounter, the best way to determine how to do what needs to be done is for people to sit down and talk to each other. And that's something that restorative justice does. Also, transformation. This can cause fundamental changes in people, relationships, communities. And through this work, I've learned that an awful lot of interactions that people have, as the mayor was saying, really don't require the police. And so we try to work with those interactions between police and vulnerable populations who need specialized resources can go wrong in many ways. By sending the right resource to the right call, we can set the stage for repair and transformation in many communities that have been hurt by traditional policing.
And I'll just leave my mask on here for the introduction, but we have two more folks we do want to hear from. The next one is our commander from the Southeast Area Command, actually. So while we're here, Commander Yara is going to speak next. And I want to mention to folks who are watching online, we're in the International District at our city's public health and services facility. And this is a facility, this is another example of the kind of services that we think can be part of a department like this. And it's really talking about blending that response, one-on-one outreach with upstream services, and that's exactly what this facility provides. And so, but it also works in many ways with, of course, what's happening in the community with respect to law enforcement. And so the area commander for the International District, Commander Johnny Yara.
Thank you, guys. So as we all know, the role of a police officer, particularly in Albuquerque, has changed drastically over the past several years. Field officers are running from call to call many times. Those calls involve a mental health crisis, drug or alcohol addiction, and homelessness. And during many of those incidents, there's actually no crime being committed, not even the threat of a crime. But police officers are called out to address these associated problems. We have devoted a lot of training to prepare our officers for these interactions, and we've incorporated a lot of specialized units to also deal with these interactions. But the problem isn't getting any better, and it limits our time to implement real community policing. As we know, and as we've seen with protesters during the past few weeks, a uniformed police presence isn't always the best option if the goal is to de-escalate a situation. This new department, Albuquerque Community Safety, has the potential to get the root of some of the problems in our community. It will also lift some of the burden from APD. This new, more focused scope means more time for community policing. Bike patrol and beat walks by our PRT units have been incredible, but they are extremely resource intensive. At the same time, the mayor recognizes that we still need to hire more officers. He knows we were severely understaffed while trying to address more crime and more problems. We will keep you informed as this new department is created, and we welcome your input to make sure it is effective. You know more than anyone that what we're facing on the streets of Albuquerque. Thank you. Thank you, sir.
Okay, and now we're fortunate to have a city councilor who cares deeply about this intersectionality challenge that we're facing, and she's also the chairwoman of the Public Safety Committee. I don't know if that's the official name, but Councilor Lenson.
I appreciate the administration for shedding light on this idea that is an investment in our public safety, our community, and the city of Albuquerque in the face of national and local challenges. This is just the start of the process, and as a counselor, I am committed to helping bring this to life through the upcoming budget process. The unique challenges that our city faces require a nuanced approach that extends beyond the rhetorics that can also often be divisive. However, the issues at hand are more important than what drives us apart. This idea allows us to bring in community to have the important discussion and listen to their lived experiences while taking action to make a difference. Through this proposed department, community will have the opportunity to share their perspectives of how to address mental health and behavioral health issues and not to criminalize it, to evaluate public safety with a social service, public health, and restorative justice lens. I look forward to working together with our community and local partners on this fundamental shift to our approach to public safety that has the potential to save lives. Thank you.
Okay, thank you so much, Counselor. And, we have a lot of work to do, right? This is the beginning of what we hope is a transformative concept. And we know that it cannot really leave the finish line without lots more community input and engagement, and of course, without City Council's help as well. And so today is the beginning of the process to make this department a reality. And so for us, we also know that we have been doing many of these things in a either smaller or pilot fashion. So we know that we can do this. That is not a question. We know we can do this. We do have to work out the details on how it's, of course, going to work best. Now, this is an Albuquerque idea for, in some ways, local challenges that we have, but in many ways also nationwide challenges that we are seeing around the country. And so this is about us carving a path that's right for Albuquerque. But I also believe that in many ways, we are listening to the concept of how cities should conduct their engagements with the public in an emergency or in a 911 response situation. That is fundamentally true in every city. And I'm proud to say that Albuquerque is at least looking at an innovative new model to literally restructure and transform how our city responds to these challenges. So like all things, our success is going to depend on us continuing to work together on this as one Albuquerque. So with that, we are here for your questions, and as usual, what we'll do is repeat the question for those watching online, and then we'll also tee up the relevant expert to speak to them.
Mayor, we'll start with one question from Zoom, and then we'll move to in-person, because I think we'll have more here. For Brian Laughlin at KOB, what was the level of communication like between the Black Lives Matter protesters and you? Is this new public safety model something that they had asked for or had any input on?
So the question specifically is about our communications with BLM protesters and so forth on this model. And so I have had personal communications, both casual at different events and also in our office, and we actually continue to have those. But I think most importantly, we've had those discussions at multiple levels. We've had it with faith leaders from the Black community as well, even with our police department, and we've had it through our equity and inclusion office, which is really, this is part of the reason why we formed this office, is to really have some folks in City Hall who have deep roots in the community. And so we've had those conversations at multiple levels. And again, this idea is born out of that input, but it's actually born out of an idea that we've been working on for a few years. And I think now we realize how important it is. And now we realize that we've got to move on it. Before, we were still sort of thinking about researching and piloting and task forcing and white papering. Now we're convinced we should just do it.
Thank you, Mayor. We have one here from Chris McKee at Keller News. Can you tell us a bit more about where the city is at in the planning process of this department?
So the question is, where are we at in the planning process of this? I'll give a short answer, and then I'm going to ask our CAO, Sarita Nair, to talk through this a little bit. We get this question quite often. And so I want to remind folks, this is a really good reflection, I think, of continued leadership in this area. But it's transitioning what we've been doing informally through a working group to a restructuring in terms of how our city responds to the public. That's the big shift that we're taking. But the good news is we actually already know how to do some of this. Sarita?
Thanks, Mayor. So the question was, where are we in the planning process of this department? And I would just return to that, where I started in my comments, which is the Public Safety Working Group has been tackling this for about 2 years without really knowing what we were doing. So we would look at substance abuse challenges and we would come to this conclusion of we need a different kind of response. Then we would look at homeless challenges and our gaps in service provision, and we realized, okay, we need a gateway center, and we need a different kind of response. And all of our roads kind of led to the same path, and Chief Dowse, who's here, took a leadership role in a lot of those conversations, and over time, it just continued to emerge. Like, we need a third tool in that tool belt. We need a third path for a 911 call. And that's where this idea originated. So we've been doing that incremental planning all this time. But now that we've actually said, okay, let's commit, let's create this third response department, we'll begin the process of really getting into the weeds on what it's going to look. How is this going to work out of dispatch, 911 dispatch? How is this going to look in terms of staffing? What is the org chart going to look like? What are the SOPs going to look like? We have to think through all those issues now, and that's where the community input and the input of experts and professionals is going to be really critical.
We'll switch to in-person for a minute, and then I'll come back to Zoom.
Question here.
Sure.
As far as a price tag associated with this, is there an estimate? Where do you suggest some of these funds come from?
So the question is about sort of the price tag and the funds. And I want to speak actually a little bit more to the previous question, which, and then go back to yours. As mayor, I view my job as, it's fundamentally, gratefully, I was elected to lead our city. And to me, that means listening to lots of different folks in lots of different ways. So I listened individually, one-on-one, to folks I met with and had my own meetings. But I want to emphasize this. I listened to the city entities that are responsible for coming up with answers. That means listening to our public safety group. That means listening to our faith leaders working group. That means listening to our director of equity and inclusion. It means listening to our counselor at Land Senna. And that actually, this is the aggregation of input from multiple city folks who are much smarter and have much more expertise than I do. All I decided was that we're going to make the final decision to pursue this. And so I think that's the right way to do it. This really was a bottom-up approach. This wasn't about me just having a couple of meetings and coming up with an idea. So that is relevant to the budget question. We can do this with existing budget because, as we mentioned, these groups, even our Homeless Advisory Council and our Mayor's Youth Council and our Kids Cabinet, they have all been working and talking about this issue for several years. And so we know that we can use existing programs and units and divisions and combine them into this restructuring. So it is a refocusing, it's a restructuring, it's a reinvestment. Now, we do want to add some funding, especially into our violence intervention and our diversion programs. So the long answer to your question is we can do this with existing funding. It's truly restructuring. But we also want to invest in areas that now we've seen show progress, like violence intervention and diversion.
Thank you, Mayor. So you've made it your top priority, public safety your top priority, obviously promising to tackle crime, particularly violent crime when you were elected, but as you know and you've said, it's still a huge problem in our city. You've also made it your goal to grow APD to 1,200 officers. So can you talk a little bit more about how this new community safety department will help tackle violent crime and also keep that promise you made when you were elected?
It's a very good question. I think this speaks to the core of the op-ed that I shared with you from Honor, who works as a clinician with our police department. And it just speaks to the fact that for better or worse, in Albuquerque, we have to do both. So we've got to invest in these social problems and these upstream challenges that drive crime in the long run, but we also have to fight violent crime directly. And for that, we need more officers. We have a documented shortage of at least 400 officers from when I came in the door. I remember, roughly when I was in high school, we had 1,230 officers, right? I walked into the door to about 850. So, and what Commander Yara mentioned is especially important. To do community policing, to have what we all love, which is bike cops, folks walking the beat, folks engaging with the community, it also takes more officers, right? The way to police a city with less officers is to just have everyone allocated every morning differently in a car driving around the city. We do not want to do that. I ran for office to not do that, to move away from that and to get to community policing. So we do have funding in the budget. Now the exception is Corona. Corona is a budgetary challenge for everything, and that includes law enforcement and everything else in between. But other than the corona economic challenges that we may or may not have. We do have funding in the budget to continue to meet our hiring goals with respect to community police officers.
So just to be clear, this isn't about like defunding APD and having officers kind of step aside, right?
No, this is really about refocusing officers on core community police work, and it's about reallocating and restructuring all of our responses when they're not crime related.
Have you looked at all about like how many of the calls that officers go out to these community service aides would respond to? Is there a percentage or a number you could give us?
So the question is about some of the numbers in terms of what we're talking about here, and what we can share with you is some slices that we have already. And so they come from different areas. So for example, we know that in our pilot program to send fire and paramedics out for down and outs, we know we were able to pull 15,000 calls away from the police department. We also know that with our abandoned car program, which is sort of interesting in our town, you might see the car on the street with the orange tag. This is a huge issue in our city, and it takes, we know there are thousands of backlog cases for this. And historically, we would send one officer, if not two officers, to check on those. Now we're trying to shift those to our security folks, our unarmed, we call them the municipal development security folks. So that's another example of sort of the numbers that we're talking about here. There are some others as well, and so I want to check with if Sarita wants to speak to those.
So the other relevant number is behavioral health calls. I don't have the 2019 numbers, but in 2018 and in 2017, there were about 6,000, 6,200 behavioral health calls. Only 3% of those resulted in arrest, which suggests that at least for half of those calls, the police response probably wasn't the right path.
We do have one more example from our fire chief.
So like the CAO said, we've been doing these kind of things for the last couple of years. One of the first one we did was the needle pickup. So if you remember a couple of years ago, you'd send a 40,000-pound, 4 people on a fire engine to go pick up a needle in a park. That's not a good use of resources. So of course they would go out there, and the average call was about 20 minutes to go find the needle, pick it up, put it in a sharps container, and we found a better way to do that. So we're using different resources in the city. So Parks and Rec is actually taking some of those calls. Same thing with the down and outs too. So the mayor talked about 15,000 calls that are going over to fire with those down and outs, and we kind of refined that even further, and we started dissecting the numbers, and we found that 10,000 of those 15,000 calls were what we call ghost calls. So we would get a 911 call and say somebody's out on a park bench or sleeping in a park. We're not sure of their status. Fire truck would get there and then find out there's nobody even there. So it was a ghost call at that point, or the person didn't need any assistance at all. So we refined that. We started working with city security on wellness checks. We found a resource that was already there in the city, in the central corridor, that was available to take those calls. All we had to do was give them some training, radio, mobile data terminal, basically a computer in their vehicle, and they could take those calls. And that's saving calls from public safety, which is what we all want. When you call 911, you want law enforcement or you want fire paramedics to get there as quickly as possible. But if they're doing something else that is not law enforcement centric or fire EMS centric, then they're tied up on those. They can't respond to those critical emergencies. So this is a great plan. We're really excited about it.
Other questions?
Mayor, we have one here from Kristen Key at Cares to me about the budget for this. At this point, does the city have a rough or even ballpark figure on how much this new department costs?
So the question is again about the budget for this, and I want to emphasize that our initial starting place is no incremental funding. So the net budget cost is no change. This is about restructuring and reallocating and investing in different areas. But to speak to what we're looking at, we think there's at least tens of millions of dollars that are going to move in this process. Now, we do anticipate some budget requests around violence intervention, around diversion and so forth, but that'll go through the normal budget process. And that process during Corona time is now totally different, but basically we're going to work on it in July. We'll probably submit our budget in August, and there are some kind of fiscal reasons why we probably need to finalize that budget by the end of October. But that is council's choice. Of course, council is the appropriating body for the city.
I have another question. Since you've been in office, are there any OISs addresses any officer-involved shootings or any use of force that you think would be more appropriate to have a community service aide instead, and that would have had a different outcome?
So the question is about some of our own OISs, right? And we know the biggest challenge we've had in our city actually is around mental health. Again, we have all the challenges that every major department has. The Albuquerque version of this has been primarily around issues around mental health. So certainly this program should help a lot with that. But it's about a couple of things. It's about having those calls before that actual police call that are responded to by folks who can get help, so that's on the preventative end. There's also a de-escalation piece. So we're hoping that we might be able to de-escalate a lot of those calls by having a civilian response first. Now, specifically, of course, a lot of those are under review with the DOJ and so forth. So I just want to emphasize, I'm speaking generally about these challenges that we're having, not about specific ones. Let me just check. Do you want to add anything else to that? Is that good for now? Okay.
Like the one in March, at the end of March, where there's a welfare check, is that the kind of thing that maybe a community service aide would be able to?
Certainly, the concept, and this is a good example, we call them welfare checks, and they come out of APD reform and out of the DOJ process. And they're trained officers that have been through additional CIT training typically to do a welfare check. Now what we're understanding is this whole concept of just asking an officer to get some training and then do more for new problems, we really got to think about. And this is something different. We would hope that, again, the non-violent or non-criminal welfare checks could be done by unarmed civilians who are professionally trained. That's what this is about.
So it would be fair to say that had this program been in place in March, in the end of March, when that shooting happened, that maybe somebody from this program would have been dispatched instead of not?
So certainly in general, yes, and that's a big reason why we're doing this department. All right, I know also the air conditioner is broken here, so we're going to go ahead and cut it off if there's no other questions. All right.
One more question?
Sure.
What about, Sarita had mentioned hiring some more people and trying to get this pipeline. How does that use for that, and how is their pay comparable to police officers or other people doing this work?
This is a good one. So I'll hand it off to Sarita, but the question is really around this pipeline of professionals, especially social workers and so forth. And I want to mention to folks, this is like a good example where our city is in a different place than a lot of others. We've been trying to do this. We have budget money to do this. The issue is there's no pipeline. So we do have an idea for that, and I'll let Sarita speak to it.
So thanks, Elise. The question was, do we have an idea of how we would recruit and hire and position people who were in this department? I think, this is definitely something we'll be working on, but we have social work positions both in the department and in some of the nonprofits that we contract with that could be a model for both the qualifications and the pay scale. But of course, some of that goes into whether, they're classified or not, or where they sit in the org chart. So we would need to think through all that. But I did want to mention, you've mentioned community service aides a couple of times. I mean, certainly that's one type, that's one flavor of the responder that we're talking about, but not everyone in this department would be in that community, the CSA model.
Do you know how many people you would expect to hire that you just not any calls?
I think first we have to look, so the question was how many people do we expect to hire? First we need to look at how many people we can marshal internally, how many people who are on contract we might want to bring in-house, and then we'll know what the balance is and what we need to hire externally. But that's where that pipeline program is going to be really important.
Okay. All right, with that, I think we will see you again tomorrow. We're going to really focus on Corona tomorrow. We'll see what happens, but that's the game plan. Thank you very much. Thanks. Oh, it's off.